Are you worried that your ear discharge isn't stopping? Does ear discharge stop without surgery? The ear has normal waxy debris, which under usual circumstances self-cleanse. It can get impacted in dry weather, dehydration, people who drink less water, etc. Interestingly, there is an incidental history of constipation and impacted wax in adults and children. If ear discharge is purulent pus with earache and you can't touch your ear, it can be a bacterial or fungal otitis externa. You definitely need to check it out. If earache occurs with swallowing, belching, chewing, and occasional mucoid mixed with pus or blood occurring for a few days, usually after 7 days of upper respiratory tract infection, that is cold or cough, it might be acute suppurative otitis media. Timely consultation with an ENT doctor will definitely help you get better. It will help you stop the ear discharge and prevent long-term complications like hearing loss. When you visit your doctor, the doctor will take the history of ear discharge. How long has the ear been discharging? What kind of discharge? Whether the discharge is for several years, for several days, several months, everything is important. Whether it is profuse, mild, moderate, whether it makes your pillows wet, or does it have to be cleaned with a earbud. A perforated eardrum can cause ear discharge. A eardrum intact with outer ear having infection related to fungal infection can also cause ear discharge, but it will be of a different nature and not mucoid. So these are the different things that your ear doctor or an ENT specialist will check when you visit them. The condition will need surgery if your tympanic membrane, or that is the eardrum, is perforated, and it could be the reason behind all your hearing trouble. Ear discharge occurring for more than 3 months with a perforation might be a condition known as chronic suppurative otitis media. But what if you have ear discharge even after surgery? When a modified radical mastoidectomy or a radical mastoidectomy is done, sometimes the extensive disease requires an extensive cavity. That leads to cavity problem. Now you might be asking me, what exactly is radical mastoidectomy or modified radical mastoidectomy? Mastoid is a part of your bone behind your ear. The temporal bone has a process called the mastoid process, where all the debris due to the infection in your ear can get accumulated. The bone rots from within. So while your doctor is operating, he will be taking out all that granulation and debris causing heaviness in that part of your ear. So that is called a mastoidectomy, and how much of that bone is removed depends on how severe the disease is. So these are the different types of mastoidectomy that can happen. When the ear has a huge cavity following surgery, sometimes it can cause a different kind of discharge, which is called a cavity problem. In all these cases, your ear surgeon is the best person to explain the reason behind your ear discharge. In case of cavity issues, a second stage surgery might be needed. Sometimes reconstruction of the canal wall also needs a second stage surgery. In India, sometimes the patients are not able to come back for a second stage surgery, and that's when the problems persist. In case of ear discharge after tympanoplasty, mastoidectomy, residual disease or recurrence, everything needs re-evaluation. Since a patient with chronic suppurative otitis media often have associated hearing loss, it's important to explain the problem to his or her family member appropriately too and in writing, because communication is key to understanding. The patient himself or herself might be missing out on key communication skills because of inability to hear. Another problem arises when they are not literate. So be very careful about explaining the pros and cons of hearing related issues before and after surgeries. Investigations are crucial for decision making, patient understanding, and medical legal purposes. In case of economic backwardness, the government medical colleges provide free surgery and treatment options. All the options available to the patient should be told to the patient before surgery. The complication, things to look out for are all explained appropriately so that the patient is not surprised about caregiving post surgery. Transparent communication builds trusts and helps patient get better soon.